Hi, everyone. It's Dr. Arlene Diamco, the MultiDimensional MD. I'm an integrative physician, a pediatrician, and a cranial osteopath. And my mission is to help bring the intuitive aspects of health back to medicine in practical and tangible ways so that you can access deeper healing and experience more peace, love, and joy in your everyday lives. So I am here with Alex Simmons. We're going to be talking about bone health part 2. And the reason I got in touch with Alex was because a friend of mine had been diagnosed with osteoporosis, and her physician had only given her the option of medications, prescription medications. And I was thinking from a multidimensional integrative health perspective that there was so much more that needed to be addressed before we went straight to pharmaceuticals. And so I sought out people to help me help other people address those things. So let me introduce you to Alex. He's the founder of Wholebody Systems, a therapeutic fitness clinic that specializes in longevity and bone health. And they've been Atlanta's premier provider of bioDensity therapy, a modality used to stimulate bone growth for the last 14 years. And they've developed a method for helping their clients increase bone strength, reverse osteoporosis, and avoid taking harmful medications. And so welcome, Alex.
Thank you. Thank you for having me.
Yeah.
Happy to be here.
Really excited to have you here because this is a conversation that we don't always get to have within the regular medical setting. And just to set the stage for everyone, from the CDC, men age 50 and older, they found at least 4.2% with osteoporosis, and for women age 50 and older, osteoporosis of the femur or lumbar spine was almost 20. And that was from the CDC. And then also from the NIH guidelines, they do emphasize like proper nutrition, lifestyle changes, exercises, and the prevention of falls to prevent fractures. And then there's medications. But within many medical settings, I feel like we are emphasizing too much the medications, like within modern medicine, and not emphasizing these other factors that can help with bone health. So, Alex, tell us a little bit more of like historically of like what is this diagnosis of osteoporosis? What is the background of like how it got diagnosed? Because this is important.
Well, I think that is important. And I think one of the big variable factors that gets skipped over a lot is the fact that bone degeneration is typical with aging. And so, age-related bone loss is something that we know happens in everybody starting after the age of 30. So before about 1992, to get diagnosed with osteoporosis, first you had to have a fracture essentially, and then your doctor would send you off to the nearest bone scanning machine, which in the 80s and in the late 80s it was probably 2 hours away. They were not all over the place like they are now. So it was around 1992 when a group of doctors from the World Health Organization got together because they were kind of all over the map about how to diagnose osteoporosis. So they got together in a hotel, literally in a conference room for 3 days and sat and talked about, well, how should we measure bone health and how should we diagnose osteoporosis? And it's a really interesting story. And one of the doctors that was there told it, and her account was that the research didn't really give them a specific number, that they just kind of got tired after 3 days of deliberating and then just decided to draw a line in the graph. And that's basically where the osteoporosis line was drawn, was at negative 2.5 standard deviations away from what they would consider peak bone mass for a 30-year-old. So that's how osteoporosis was defined, as a specific amount of bone mineral density. What's really interesting about that story is they drew a line. They said, okay, everybody on this side of the line is osteoporosis, but we should call the people that are just on the other side of the line something too. And it was originally named osteopenia for research purposes. It was not supposed to be a diagnosable disease, But they said if you're just close to the osteoporosis line, we're going to call that osteopenia because you're showing kind of early stages of bone loss. And so in that process, by almost just giving the name osteopenia to that early stage of bone loss, which is really age-related bone degeneration, we now have millions of people being diagnosed with osteopenia as a disease that's treatable with pharmacology. So we have millions of women that are now taking sometimes, harmful medications where really all they have is age-related bone degeneration that can be stopped by a bunch of different things. So that's really kind of what we try to do, is we try to approach it from the natural holistic perspective and look at, we call it the END method. Basically, we use exercise, nutrition, and diagnostics. So we want to test extensively. We want to do a complete nutritional analysis, and we want to use the right type of weight-bearing exercise where we can stimulate bone growth. And that's what we've been doing.
And I want to talk a little bit more about this DEXA because it measures bone density.
Correct.
And then I had talked about in the prior podcast episode on bone health that bone density is not necessarily indicative of the bone quality.
Correct.
Or the bone health.
Correct.
And so there are newer technologies. What's great is that we can develop new technologies and we can start to distinguish quality from health. And so can you tell us a little bit more about that?
Sure. So, we'll start with the bone resorption process, which is, I think, important to understand. And I'm going to break it down in a very, very crude method and basically simplify it as best as I can. So when you start to build bone, there's two cells that go to work: your osteoblast, that builds new bone tissue, and the osteoclast that removes the old dead bone tissue from the bone. So as that process is working, you're reforming the bones time and time again throughout your life. So when the resorption process is effective and healthy, and your osteoclasts are doing a good job of cleaning the dead bone tissue out of the bone, then you're left with healthy bone tissue in its place. But if the osteoclasts are not doing their job well, if they don't clean out the old dead bone tissue, some of that tissue can become stuck inside the bone. And then it becomes mineralized and calcified, and it can affect the integrity of the bone tissue itself. So there's strong potential to have low bone density and high bone quality, which is really better than the inverse. You would rather have that than to have low bone quality and high bone density, which is actually put you at a greater fraction.
I love that. So if you love science, you can remember osteoblast, B for building, osteoclast, which I love how you said cleaning, because people think about osteoclast as breaking down the bone. But if you think of osteoclast with a C as cleaning the bone, then you can start to understand why it's important to have that kind of balance, because our bodies and our cells need to constantly rejuvenate. And if you start to have bone that starts to get old and hard, so even though it's dense, it can be more brittle.
Correct.
And that is not the fine architecture of the bone as it's meant to be. It's meant to have this crystalline matrix that's has a lot of strength to it.
Correct. It's supposed to have some give to it. That like bone tissue is supple in nature. It has microarchitecture that allows it to withstand impact. And when that tissue doesn't get removed, it becomes brittle and calcified. Then there's no give to it, and it breaks. It becomes very
And this is so crucial, because I hope that more and more people understand that crystalline matrix, that architecture is so important. And there's things that we can do to help with the architecture of your bones.
Correct. That's right. So, there's a lot of things. And this is where I think it also comes down to looking at how we talk about osteoporosis and what it is. So when we get someone with an osteoporosis diagnosis, what we like to try to do is try to help them understand that bone loss is really a symptom of potentially a bunch of other things going on. And osteoporosis is just a certain categorization of bone loss. That just means your bones have gotten to a certain level. So the root cause analysis for bone loss requires a lot of diligence. And what we do is we look at 3 categories of risk factors. The first thing we're going to look at is your pre-existing risk factors. So these are things that you cannot control, right? So, and this is being small framed, females typically, postmenopausal, typically Asians or Caucasians. So, if you fit that profile, then you're going to be more predisposed for bone loss. The second category is your behavioral risk factors. So this is essentially your history of diet and exercise, and it goes back to as far as you can remember. So even when you were a baby, if you were malnourished as an infant, if you were sedentary as a child, if you were anorexic as a teenager, or you had major drug problems in your 20s, we don't know what your baseline bone density was like at 30 until we do that full analysis and we try to think about those things. So what we try to do is we look at your pre-existing risk factors, and then we look at your behavioral risk factors, and we try to determine, does your bone density make sense knowing what we know about these two things? And if the answer is no, that's when we look at the third category, and this is systemic factors. And that's when we open the door to all kinds of potential things that could have been affecting your bone density and your bone quality. And this can be nutrient absorption through the digestive system. It can be absorption of vitamin D. It can be other harmful habits. It can be thyroid related. It can be hormonal imbalance.
Yes.
So there's a bunch of different factors that go into this.
And I would say this is where it is important to work with your healthcare practitioner, your physician, and especially from a holistic integrative approach, because there's so many things to look at. There might be hormonal things to look at. You might need to look at parathyroid hormone. You might need to look at the nutrients, as Alex was talking about. And there are actually studies out there showing that vitamin D and vitamin K2 in particular, which helps bring the calcium to the bone. So we need the vitamin D for the calcium absorption, but we need the vitamin K2, especially vitamin K2 MK7, to bring that calcium to your bones away from the arteries. And yes, I've had family members that just started taking vitamin D, K2, started exercising regularly, went from like no exercise to regular, consistent, gentle exercise, age-appropriate exercise, and like ability-wise as well. And then taking these key supplements, adjusting things in diet, and we're able to improve their bone. Their diagnosis basically change, which if you read a lot of times on the website, and many medical websites too, it says that there's no cure for osteoporosis. But I did have a family member who did not take any prescriptions and did this and was actually able to reverse it. So there's already a case like in my close inner circle, but I know that Alex has seen so many other cases of reversals of osteoporosis. Yes. Which is what we would like to get the message out here, that there are things that you can do about it and help empower you as to what those kinds of things can be.
Yeah, and I think the important part about that is understanding that it is a holistic process, and there's not going to be a one quick shot solution. The other important thing to keep in mind is that it's not a solution that ever ends. It's about creating lifestyle changes that affect the way your body continually remodels bone over time, because that resorption process continues until we perish. So if we're not removing and still building new bone tissue constantly, then we're going to have degeneration over time. So there's no solution where you take something, you fix it, and you're done. You're good. You've got healthy bones. No, it's about creating good habits.
That's a health is in the flow. So it's a constant practice. Taking care of yourself.
Consistency with habits over time determines where we end up in the future, and particularly with bone health, because it takes a long time. These things don't remodel themselves overnight. So applying consistency and committing to the habits for long term is how we make that happen. And I think that getting to that kind of realization sometimes is difficult for people, because when I talk to them about that a lot, and they say, well, how long do I need to be doing this? And I say, you don't ever stop. Diet and exercise are lifestyle changes. They're not therapeutic modalities to be used in short bursts. So I think that's part of the challenge that people have a lot of times, is understanding that you've got to make a shift in the way you approach your health altogether. And you make these investments on the front end, not waiting until you have symptoms or until you break a bone or until you have severe osteoporosis from a test, but rather, trying to get ahead of it and create these good, healthy habits that prevent you from losing bone in the first place. That's really where we should be.
Yes. So can you describe some of those exercises, or what do you do for yourself, or what would you recommend for someone like me, which is all those risk factors you mentioned? I'm like, kind of approaching a lot of those. So it's starting to become both
So
personally and
right.
professionally interesting to me.
So what I like to do when we talk about exercise for osteoporosis, I think it's important to differentiate between cardiovascular exercise and strength training. And a lot of times you can do them together. You know, you can do like a body pump class. A lot of cardiovascular exercise includes resistance training. But for our purposes, it's important to differentiate because strength training is more stimulus related and intensity level of the stimulus related versus cardiovascular, which is more duration related. So you can't take a magic pill for cardiovascular exercise. It just takes time. But to strengthen your bones through weight-bearing resistance, it does not take a lot of time, but what it takes is a very intense amount of weight-bearing stress. So we have to expose your bones to multiples of body weight, literally hundreds of pounds of weight-bearing pressure to trigger the response in your brain to say, hey, this person's trying to carry an elephant or something on their back. We need stronger bones to do it, which is why smaller people are more prone to bone loss because gravity doesn't have a big effect on you.
Okay, so I have a question. How do you keep, because you said hundreds of pounds. I was like, how do you keep that safe for someone? So you're dealing with people whose bones are already
correct,
like, have some wear and tear and brittleness to it. So how do you keep that safe?
So there are some traditional modalities. Like if you work with somebody who really knows what they're doing, we personally use a device that was designed for this express purpose. It's called bioDensity, and we use isometrics. So it's an osteogenic loading device is the name of the modality. And we use isometrics to create these weight-bearing forces.
Can you break that down? What do you mean by isometric?
Isometric means pushing against something that doesn't go anywhere. So if you take your hands and you push them against each other, you're getting force, you're getting stress, but there's no movement. So we have a device where we set you up and there's 4 different positions where you're applying an isometric force where we are able to produce this great amount of strength that results in this fantastic amount of weight-bearing stress. And so there's no gravity, there's no range of motion. So we really are limiting the potential risks for injury and maximizing the potential for getting the greatest load that your body can withstand. So we've been using this technology for 14 years now. We have 3 offices with 6 devices, hundreds of women that have had success in strengthening bones without medication. It takes consistency and commitment to long-term.
That's amazing. And when you say consistency, what kind, how long, how infrequent is
once
that?
a week. So, I mean, for us, we have people that come see us once a week. They do 4 exercises. Each exercise they do 1 time for 5 seconds. So it's literally 20 seconds of exercise once a week is all that it takes to stimulate the bone building response in your brain to produce new bone tissue.
And that takes, you said 15 minutes.
No, it can be less than 15
Less than
minutes.
15. That is, that to me is incredible.
You can be in and out of the office in 5 minutes once a week. And that's enough to reverse your osteoporosis and strengthen your bones. If you are able to check all of the other boxes on the back end. So that's where it gets really tricky. And when I first started using bioDensity, the thought was, well, you've got this weight-bearing exercise machine that triggers bone growth, and we're just going to strengthen people's bones. But it's not that simple. There's too many other factors and too many other variables involved. So for our process, and I think this is what anybody needs to do when you're screening for osteoporosis, is you need to do an immense amount of diligence. You need to do the nutritional analysis to understand your micronutrient breakdown. Do you have a deficiency somewhere? You need to do the behavioral analysis and look at your history of diet and exercise and try to figure out if there's something that needs to change there. You need to understand your hormonal balance. If you're a postmenopausal female and you had massive menopausal symptoms and your body has not regulated itself hormonally, it doesn't matter if we put that stimulus on your body's not going to be able to produce the response that we're looking for. So what I like to say is it's the dynamic of the how and the why. Okay, so you have to make sure your body has the how. Do you have the ability to produce these new bone cells? And that comes down to having good nutrient absorption, having good hormonal balance, and having good overall systemic health. If you have the how, then we can give you the why, which is the biodensity stimulus. So if you have the why, so if we use this stimulus on your body and you don't have the how, then we're not going to produce new bone.
Mm.
Or if you have the how, but you don't ever experience the stimulus and give your body a reason why it needs to produce new bone tissue, then you'll never do it. And that's how we end. So we have to do both. You have to be sure that you're systemically balanced, and then we have to use weight-bearing stimulus to trigger those body's adaptive responses.
It's so interesting because you can see the story of someone through all of that.
Yeah.
Like all the things that you're mentioning, their nutrition, like if they're able to do it or they need some things to rebalance before they have that stimulus to build the bone. And if I expand it even outward into a bigger, grander perspective, like for me, since I talk a lot about like spirit and consciousness, it's, are we embodying ourselves fully? Are we like fully present in our body? Do we feel grounded in our body? Because that way your energy is flowing throughout your whole body, your circulation is opened up, there's less tension. And so you can get the nutrients to where they're needed. You can get the delivery to the bones. You can have the pathways to drain the inflammation or anything else that needs to be cleared to remove toxins. So all systems are going, and you feel more alive.
Yeah, well, I that's a perfect segue into talking about where I think bone health is not just relevant to whether you're going to have a fracture at some point down the road. Bone health is a great systemic metric for overall health balance. You know, so if you might not be presenting physical symptoms anywhere else other than deterioration of your bones. So for monitoring that, and we see your bone density continuing to decline, we know some other things are not right in the system. And you may not be experiencing any symptoms. You may say, I feel fine. I feel great. I'm sleeping well and all these things.
You must see that even in like non-medical terms of like seeing if someone looks vibrant, if their color is good, if they have like light in their eyes, and the resonance of their voice, how their body is moving. 100%. So even if we don't put like any clinical medical terms on it, it's this health that's shining from within, and then you can see that radiating outwards. And I feel that once you get used to seeing that you're able to see it for yourself and for other people. It's the same like for families, for parents. If your kid is sick, that you can tell that they're just not quite themselves. Their eyes might look glassy. Maybe their color's a little off. Their energy's different than usual. Their behavior, their emotions might be different. And so somebody else that doesn't know your kid as well may not be able to see all those subtleties, but you know, and the sooner you can pick up on those subtleties, then the sooner you can tend to yourself, to getting better, to your loved one. And it's much easier to do that up front in a preventative way than from the back end. But even if you are further down the road, it's not that all hope is lost, because there's all these things that we can do to address it.
All the time. I think you make a great point. You know, you can take an individual that may present and look very, very happy in their life circumstances, but maybe they have horrible nutritional habits and maybe they have horrible exercise. Well, if you were to start to change some of those habits in that person, you would see physical changes. I mean, you know, when someone is eating well and taking care of themselves, you can see a physical difference. The bone health is just a perfect reflection of that. You know, so if we're not engaging in all the proper health and wellness habits to maintain good systemic health, we're going to see that in our bones. And it's just neat now that we have technology available to see those sort of things and monitor those sort of things.
Now, talking about technology. So I know when you came in here, you're like, I just want to talk about bone health. It's not an advertisement, but I actually want you to talk about the Ecolite, because we're talking about the DEXA scan and we're talking about bone density. But we have newer technology now, and we have other ways of looking at bone and measuring bone health. So can you tell us about that?
Yes. So we've been, like I said, we've been in bone health for 14 years, and we're primarily on the solution side of things. So for those 14 years, we've been using DEXA, which is the gold standard for bone density screenings, and has been since the mid-90s. So nearly 30 years. In the last year, we've gotten the Ecolite, which is the RIMS technology. It's an ultrasound bone density scanning tool that has really shown a big light on all of the inefficiencies of DEXA. And what we have learned about DEXA since seeing the ultrasound and the Echolite is that there is just a tremendous margin of error and potential for there to be bad scores. And so one of the things, and I love kind of referencing the ISCD, so that's the International Society of Clinical Densitometry, is a international governing board that sets standards for the densitometry world. And they publish standards about every 4 years. And so I just reviewed kind of the last set of standards. It's about 40 pages. And about 7 of those 40 pages are all of the things that you have to do right for your DEXA machine for it to be accurate. And so if you're not if you don't have a DEXA technician who has been DEXA certified, which the statistics show that less than 5% of DEXA techs actually get certified.
This is really good to know, because it's like how you measure something really affects your outcome.
Affects everything. I mean, we see people all the time that are making huge life decisions and huge investments based on this data. And with the other thing, so ISCD, they publish a couple things, and I'm going to reference a few of them. They make it known that you cannot compare 2 different DEXA reports from different machines. So to me, it's like, well, if that is a published fact by the ISCD, and they recognize that, then how can you trust the scores from either one of those machines?
So they are the regulating organization,
board.
But that's not necessarily common knowledge for people.
No, it's not. It's an international board. And so, if you get scanned on one DEXA machine, then you go do 2 years of whatever sort of treatment. It could be natural, it could be pharmacological. And then you go get scanned on a different DEXA machine to see what your results are. You can't compare those 2 reports because they have been calibrated differently. So if they've been calibrated differently and they produce different numbers, then how can you trust the baseline number for either one of them? And that's where I think this gets really, really sticky. And where the ultrasound is, and so the Echolite is much different. It all but eliminates the potential for user error. So it's a handheld ultrasound wand. We're going to scan each bone individually. And with the Echolite, if I don't scan your bone at just the right depth, at just the right angle on the right surface, it won't give us a bad score. It'll just tell us to do it again.
Now, for the DEXA, I know you had mentioned that it's user dependent. So if the technician was different, then the score can
potentially
be different.
If they don't do everything the same.
What about the Echolite?
Like I said, there's an artificial intelligence mechanism that will not allow us to get a bad score. So if the user for the Echolite doesn't do it right, the machine will say, hey, you didn't do it right, do it again. And it won't give us a bad score. We could scan you 10 times and not get a score if we don't do it right.
So this is great, because this is an example of where we can use technology for good, or benefit instead of in destructive ways.
And that's what, when I talk about someone with osteoporosis, we have kind of this is the protocol. When you get diagnosed with osteoporosis, what do you do? So my first step is always take a deep breath. Because I get this a lot, and sometimes I'm fortunate if I can get them, the same week or 2 weeks after they get the diagnosis, but sometimes it's 2 years later, and I talk to people that, well, my doctor said I had severe osteoporosis, and so I've been Googling this, and I saw this doctor here, and I saw this doctor here, and a lot of times it's with it's very ambiguous. There's a little bit of information that comes with it, and it comes very heavy-handed. A lot of times with very strong influential tactics to try to get them to take medication.
And then, so most of those, because the Ecolite's not widely available, have been diagnosed with a DEXA.
With a DEXA, correct.
So do you recommend that they use the Ecolite to get a more refined picture, or do you go with the DEXA diagnosis?
So what I would recommend is, if you get a DEXA test and it shows that you have osteoporosis, before you do anything, get tested again. And
with a DEXA or Ecolite?
Well, preferably with an Echolite, because it is going to be more precise, and you are going to get a bone quality score in addition to the density score.
And that's new.
That is entirely new. We'll talk about that in a second. But if you don't have access to that, go to another DEXA machine is what I would recommend. Don't get scanned again on the same machine. Say, okay, well, this machine scanned and said I have this. I'm going to go to another machine and get scanned. and see what that one says,
Mm.
because
Like a second opinion.
you get a second, it's a second opinion. It's exactly
Especially
right.
if you're up against a decision,
Yeah.
taking like
Yeah.
medications that
It
might
can be
have detrimental
it can be
effects.
life altering. Some of these medications, once you
Do you
start
wanna-
taking them, it's very difficult to get off of them. There's, long-term side effects. There's short-term side effects
Mhm.
that are harmful. So I tell people, before you consider doing anything invasive like that, be sure that you have accurate data. I
Mhm.
say you can't spend enough money and time getting tested to be sure you know what you're looking at, because you're about to make an investment and about to make decisions that can impact the rest of
Mhm.
your life.
Mhm.
Perfect example is one that I had yesterday. She came to see me. She went from a 1.9 T-score in her spine in 2023
Mhm.
to a 2.9
Mhm.
in 2025.
Mm.
And she says, I just thought, how can it go from that in 1 year? And I said, that
Uh-huh.
sounds fishy.
Uh-huh.
I think before you do, and she had the Fosamax, she had it on her bedside table. She
Uh-huh.
almost took a dose. She said, you know what? I'm going to wait. I'm going to call somebody and get another test. She found me.
Uh-huh.
We came and tested with the Echo Light. It was not a 2.9. It was a negative 1.4.
Wow.
So not osteoporosis, but just barely in the osteopenia range.
Uh-huh. And again, can you just explain for people like what these
Yes.
numbers
So
are?
the T scale is how we get the osteoporosis diagnosis. If you're at a 0, that means that you have the bones of a healthy 30-year-old. Anything between 0 and -1, they consider normal bone. Anything between -1 and -2.5 is what we'll call osteopenia. And then once you get beyond -2.5 is what they'll call osteoporosis.
Mm.
So, here's an example of someone, and she said, the lady that was running my DEXA, she didn't look like she knew what she was doing. I'd never seen her before. She looked confused. She did it once. She said it didn't look right. She did it again, got the same score, and said, "Oh, that must be it." And so it was just an example of, here's somebody who, and we don't know. How do we know not to trust
Right.
what the doctor says? This is all that has been available for 30
Yeah.
years to give
Well,
this
there's multiple
diagnosis.
hoops there. It's the doctor, it's the
Yeah.
technician, it's the machine.
There's so many, like when I got through the standards, I'm reading all these things that have to go right for the DEXA to be accurate. And it's like, I can't believe all these things have to happen. And so I think a lot of that gets glossed over. I think a lot of technicians don't get trained appropriately. And then the doctors, they don't have the time or the capacity to question these results, And so it's like when they get the test results, they don't have the capacity to say, hey, let's go get tested. This is the test. This is the results. They're going based off of that data. So I think it has to go back into the hands of the patients. And so after you take a deep breath and calm yourself down, the second step is to be sure you have accurate data. Find the ultrasound option if you have it available. If not, go to a different DEXA machine. And if you have to pay for it to get it done. If you spend a couple $100, it could save you thousands and decades of
your health.
Yeah, it's a huge decision. So be sure that you have accurate data first. But yeah, so what we had talked about too with the bone quality score is what we get with the ultrasound in addition to the density score. So this is an entirely separate measure of bone health, right?
Yes.
So this is about the actual quality, the fracturability of the bone tissue. And the way that they measure this is they basically took two comparable samples of bone. One has had a fracture and one has not had a fracture. So you've got fractures bone tissue that has poor collagen cross-linking and mineralized tissue versus the healthy bone. Well, they sound different to the echo in the echo light. That's what it's listening to the echo, literally. And so when we scan your bones, it's going to tell us, well, how many of those sound samples sounded like fracturous bone and how many of them sounded like healthy bone. And it gives us a fragility score that has nothing to do with density.
Yeah.
So it happens frequently. We see somebody who has great bone density, but poor bone quality. And the inverse, we see low bone density, but great bone quality. So those are two entirely separate measures. And really the fragility of the bone tissue it's created directly out of the fracturability of that bone. So density, as it would turn out, is not as great of a predictor of a fracture as the quality of the bone tissue.
That's so interesting.
It is interesting.
I would be curious to talk to the company and see, like, I would love to see the wavelengths.
Yeah,
You know,
yeah,
because I have a feeling that if you looked at them, that the ones that are healthier would just have some resonance or more harmonic
sure,
properties
sure.
to it. And then it's the same thing when we look at different water samples, healthier water,
Right,
less
right,
healthy water. Like one seems more beautiful and
right.
has more rhythm to it.
Oh no, I'm certain of that you would see a difference in the wavelengths there, and I think when you break it down into the cellular level like that, then you are now kind of leading into more of the systemic conversation.
Uh-huh.
Because if you have poor bone quality, that means that systemically things something's off.
Something's awry.
Something's not right there, and it kind of gives us a chance to say, okay, well, what if we adjust behaviors, and what if we start trying to make some healthier habits, and let's see how that affects our bone resorption and improves our bone quality.
And that is a whole other conversation.
Yeah, that's
which I talked some about in Bone Health Part 1.
Mhm.
And so I'll drop the link in this podcast in the description if you're watching on YouTube, or if you're listening on other podcast channels too, then I'll also put it in the description for you, which episode number that is. But
Yeah.
this is really fascinating. And I hope that this helps to inspire people. Our purpose is to not to frighten you, but to empower you with knowledge and ways that you can help yourself, and ways that you can work with other people to help you too. The bioDensity is a great machine, great tool. The Ecolite is a great tool. And Alex is just this amazing resource about talking about bone health from a multidimensional perspective. And we can just keep building and building on this conversation.
We could. Well, I think there's a lot of great resources out there. And that's another one of the things that I always recommend to people is don't stop with one source of information. You have to be behind the steering wheel. You've got to be in the driver's seat. You have to do the diligence to talk to as many different people as you can, to get as much information as you can, to be able to make these decisions for yourself.
Absolutely.
And I would want to try to implore people the most is when you get an osteoporosis diagnosis, if for some reason it doesn't make sense to you, and this is how that can be. Well, I've been a super healthy person. I've lifted weights my whole life. I don't understand how this can be. Or maybe you don't fit the profile. Maybe you're 200 pounds. We're not predisposed for bone loss, and you're showing this on a test. Go get tested again. Be sure that you have accurate data, because there's a lot of reasons why the DEXA can be wrong. And just a couple of those, for example, if you have scoliosis or any sort of spinal abnormalities, that will throw off your DEXA score. If you have any foreign agents like a bone spur or osteoarthritis, that's something that can throw off the DEXA score. If your knees are not elevated and your feet are not turned in appropriately by the DEXA technician, that will throw off the score. So
basically anything.
A lot of things have to go right
Yeah.
for those tests to be accurate. So one of the biggest keys, and this is what I think is easiest for anyone who's looking at your DEXA report to pick up on this red flag. The ISCD, they in their standards most recently published in 2023, they will say that if you see T-scores that vary greater than one standard deviation from different regions, that's a red flag that you may potentially have a bad test.
Good. So to pause and not to start to get these worry loops. And
these worry loops, it becomes so bad because a lot of times this diagnosis is given with such a hard dose of fear. You're going to break your spine in your sleep. Don't tie your shoe and sneeze at the same time. There's and I get this. It happens so much where people have changed their lifestyle. I haven't water skied in 2 years, or now I don't do this and I don't do this anymore. And so we have to stop that.
I see why you emphasize make sure it's a proper diagnosis.
These
are major lifestyle changes that can interfere in a detrimental way,
in a huge way.
Helpful.
A huge way. I mean, not only you potentially take medications that you don't need, but you see people changing their lifestyles literally to avoid having a fracture when really it's not something they should be doing at all. And so I think get the accurate data. If there's something that is questionable about your test, go get tested again, and before you do anything else.
Well,
But
thank you.
the other thing too is that regardless of what's going on with your bones, you have to start strength training. So if you're not strength training, you got to start doing that right now.
Absolutely.
Right.
And there are different ways. So, do what works for you. Listen to your body. We are here for you. And there are so many different aspects to talk about in terms of like bone health. It is a piece of your overall health. It is not just physical health. It is body, mind, spirit, and you are multidimensional beings. So we do need to address all these different aspects of our being. And that's how we feel most whole
That's
and
right.
healthy. So thank you for joining me.
Thank you for having me.
It's
This
just
is awesome.
Yeah, so great to be able to talk about things in this way and with an elevated conversation to bring to light some things that are out there that are known in the literature or like hidden, but to bring it to light so that it can become more common knowledge for people and to empower you with that kind of wisdom, knowledge, and know-how.
That's right.
So if you have any questions, this video and audio is not meant to diagnose or treat, so definitely work with your healthcare practitioner. But if you have any general questions, then we would love to hear from you. You can always drop a question in the comments below. We'd love to know what your experience is. Please like and subscribe. And Alex, how can people get in touch with you?
So you can visit our website at wholebodysystems.com. There you'll find out a lot of information about our clinic, and there's multiple contact forms, which I'll also, once this is posted, we'll drop a link in the comments so that you can find us easily that way. But we've been in the Atlanta area for 14 years, and strangely passionate about bone health. So.
Yes, the first time we got together, we were just on fire because I was like, I finally found someone that can talk to me about this in the way that I've been reading in the literature, but that is not common medical knowledge, which is astounding to me sometimes. But from this perspective,
we're excited to be a part of it, and I'm excited that you invited me here, and I can't wait to work with you more in the future.
Great. Well, if anyone would like to connect with me further, you can on Instagram at All Worlds Health, on Facebook, All Worlds Health and Pediatrics, and you can always go to my website, allworldshealth.com, and sign up for my e-love letters. I send them out about once a week on Wednesdays, and I'd love to hear from you. So if anyone could benefit from this episode, then please feel free to share it with them, like and subscribe. And thanks for being here with us.
All right. Thanks.
We believe in you, so I hope that you believe in you too. Take care. Bye.